this is Admiral Buktuan, and this video we're gonna do the cranial nerve assessment. So the first thing you do is to provide the privacy of the patient. Second is the hand hygiene and explain the procedure. Okay, let's start with the first cranial nerve, the olfactory, the sense of smell. So Lauren, what you need to do is to close your eyes and have to put something in front of your nose, and you should breathe in and smell it and tell me what you smell.
Strawberry.
Okay, that's correct. The cranial nerve is intact. Next is the cranial nerve 2, the optic nerve. To test the cranial nerve 2, we have to do the two tests, the confrontation, visual field, and the visual acuity. So first, we're gonna do the peripheral vision by doing the confrontation visual field, and to do that, we have to the patient one left away. So Lauren, I want you to do is to cover up your right eye, and I'm gonna cover up my left eye. So you need to do is to focus my eye, look at my eye, and don't look my fingers, and tell me how many fingers I wanna do. So let's start.
2, 3.
Okay, now in the other side, again, don't look my fingers and focus on my eye. So
4, 5.
okay, very good. So the cranial nerve is intact. Now, the test of the cranial acuity. So, Lauren, I want you to look at the chart in front of us, but first you need to cover your right eye and read the lowest line that you can read for me.
L, R, J, and I.
Good. Now the left eye. Please cover your left eye and read.
L, R, J, and I.
Good. Now read with the both eye.
L, R, J, and I.
Very good. The cranial nerve is intact. Next, we're going to assess the cranial nerve 3, the oculomotor, cranial nerve 4, the trochlear, cranial nerve 6, the abducens. So, in this, we were going to the several tests to check their function. The first thing is we need to look, we're gonna be looking for any involuntary shaking of the eye. So, I have here the flashlight, and now, I want you to do is to stay still your head, and I want you to look at this flashlight using your eye and watch where I move it. Okay, good. Next, we're going to see how reactive the pupils are to light. So, Lauren, please stay still. It constrict. Now, let's go to the other side. It constrict as well. So, the cranial nerve is intact. Now, let's test the abducens. So, Lauren, please stay still as I put inward it in your nose. Okay, very good. Let's proceed to the cranial nerve 5, the trigeminal. So, Lauren, please stay still and clench your teeth. I want to feel your masseter muscle, your temporal muscle, and your nervus. Please open your mouth against my resistance. The nerve is intact. The cranial nerve 7, the facial nerve. So, Lauren, please close your eye tightly and open them up. Okay, smile for me. Now, frown and pop up your cheek. She did with ease, so the cranial nerve is intact. Let's proceed to the Cranial nerve 8, the vestibulo-cochlear nerve. So what I'm gonna do here is I'm gonna include your one ear. I'm gonna whisper 2 words, and you're gonna tell me what I said, and I'm gonna do the same thing in the other side. So let's start. Are you ready?
Yes.
Okay.
Batman.
Good. Now in the other side.
Iron Man.
Good. So the cranial nerve is intact. Now the cranial nerve 9, the glossopharyngeal. So what I'm gonna do here is I want you to say and I'm gonna test the gag reflex. But we're not gonna include that. So let's proceed to the cranial nerve 10, the vagus nerve. So the vagus nerve is intact because she can able to talk and wasn't talk to me without harness, and she can swallow. Now the cranial nerve 11, the accessory nerve. So Lauren, what you need to do is to move your head side to side, look up to down, and shrug your shoulder against my resistance. Very good. The cranial nerve is intact. And lastly, the cranial nerve 12, the hypoglossal nerve. So, Lauren, what you need to do is just to stick out your tongue and move it side to side. She did it with ease, so the cranial nerve is intact. So that's all the 12 cranial nerve assessment.